Hi guys, Dr. David here from the Hunter Valley Practice.
Dr. James.
Today we're talking about ankle pain. So ankle pain, very often we found that it's associated with a bit of back issues. And often when we have ankle pain, you get a diagnosis that we call Achilles tendinopathy. So it's essentially an inflammation of the Achilles tendon. Achilles tendon is located at the back of our foot, and it's the strongest and the largest ligament in our body. Is a continuation of our calf muscles that attach straight up to the bottom of our foot. So when we have ankle pain or Achilles tendinopathy, there is different factors that can contribute to it. For example, we have training areas. We increase the training volume or increase physical activity. Or maybe your ankles is not moving as well as they should. And also some comorbidities, including overweight, if you have high blood pressure, increased cholesterol, and diabetic. They are some factors that can cause this to happen as well.
Yeah, absolutely. So there's been some recent studies around this, and one of the more interesting ones talked not just about the movement around the ankle, but also how using adjustments or spinal manipulation through the lower back can improve things as well. So they did a study and they showed there was not only improvement, but in all their measures that they used were showing improvements at 6 months post-intervention. So they found that there was improvement around pain and disability. They also saw that there was an increase in what we call ADLs, activities of daily life. So people were able to do their regular activities with greater freedom, less pain, less restriction, and they were doing it more with less rest breaks and all that sort of stuff. So I think people were moving a lot easier. So this is where we're talking about beyond dysfunction at the actual joint. So using that mobilization and stretching and adjustment around that foot and ankle, or like I said, we're looking at that low back. So they found that when there was increased mobility in the low back, there was a decrease in compensation patterns and an increase in the gait pattern as well. So there was better function as far as how you can walk and less compensatory patterns in the low back as well. So basically it was a combination of that mobilization, adjustment, and eccentric muscle exercises as well. This saw the overall increase in function and decrease in symptoms. Now you also got to consider when we're looking at how long has it been there. If it's a really chronic condition, it's going to take a lot longer to heal. It's unfortunately just the nature of how it works. Part of this is due to the poor blood supply that is within tendons and ligaments. They don't heal as quick because they don't have that blood supply coming in. So it's definitely one of the big things to consider. So if you're struggling with your foot or ankles, or you know somebody who is, give us a call and let's see how we can help you out. Alright guys, have a great week. See you next time.
Bye.